Regulators.
Hello, my name is Brian and I work for the Joint Commission. If you're not familiar with the Joint Commission, it is an independent, not-for-profit organization in the United States. We administer voluntary accreditation programs for hospital and other healthcare organizations. The Commission develops performance standards that address crucial elements for operation, such as patient care, medication safety, infection control, and consumer rights. Today I'm here for a survey on your unit. However, we have changed the way we do our surveys. Today we will be playing Jacob Wants to Know. Have you played that before? No? Okay, the Joint Commission is trying a new way of making surveys for a little more fun and a lot less scary. I will ask a series of safety questions. All you have to do is be the first to buzz in with your pen light. So the person with the most correct answers will win the game and receive a prize. Okay, first question. Jacob wants to know, what are some strategies that Ivy Tech Community College has in place to prevent falls from happening? Yeah, Wanda?
At Ivy Tech, all of our fall risk patients wear a yellow colored sock, as well as a yellow armband that states they are a fall risk. In addition to the socks and the armband, there's a yellow piece of paper hung outside the door of each patient's room to alert providers of a fall risk. Secondly, we make sure all bed alarms are activated and before leaving the patient's room, and if for some reason the patient tries to get out of bed, the alarm sounds and the nurse will be in immediately. We also make sure that our beds are in locked low position, and we educate our patients on how to use their call lights as soon as they get in their room. So we can make sure that they know how to use it if they need to be out of bed for anything. When we assist our fall risk patients out of bed, we always use a gait belt. We try to keep our patients busy. Hospital staff gives patients different activities that they can do so they will be occupied and therefore less likely to get out of bed. Staff also educates families in fall prevention, and lastly, we do safety rounds. These are in addition to our hourly roundings. And in these safety roundings, we ensure that the socks and armbands are still in place and the bed alarm is still active.
That was perfect. Next question, please pay attention. Jacob wants to know, how does your staff avoid making a medication error? Here we go.
Here at Ivy Tech, we have a policy that states there's only one nurse allowed in the med room at a time. It is a closed room, which eliminates all noises and distractions, so our nurses can solely focus on medications being pulled. Once those medications are pulled, we enter our patients' rooms, and we always do our 5 rights of medication. Those include right patient, right drug, right dose, right route, right time. After confirming our 5 rights, we go over each medication with our patient and make sure they understand why they are taking the med and ensure they have no further questions. We always make sure to place a 0 in front of the decimal points and never behind them. We ensure proper storage of all medications, and lastly, we document everything.
Victoria? That was correct. Jacob wants to know, how do you properly waste a medication? There we go.
Okay, so to waste a medication at Ivy Tech, we always need 2 RNs to be there. So for example, if my patient were to be prescribed 6 milligrams of morphine and it only comes in a 10 milligram vial, I would ask a nurse, who wasn't busy of course, if she had time to do a waste with me. Together we would pull the med and read the 6 milligrams, and then I would waste whatever we didn't use, and it would be observed by the other RN, and then she would put her fingerprint on Pyxis, which states that she saw it.
Good job, Aiden. Jacob wants to know, what would you do in the event of a fire in the unit? Victoria.
In the event of a fire at Ivy Tech, we practice the acronym RACE. R stands for rescue. Rescue anyone in immediate danger from the fire. even if it does not endanger your life. A stands for alarm. Sound the nearest alarm. C stands for confine. Confine the fire by closing all doors and windows. E stands for extinguish and evacuate. Extinguish using the closet fire extinguisher if the fire impedes your evacuation. Evacuate to your designated meeting location.
That was correct. It is great that Ivy Tech practice race. That answer was correct. Since you answered 2 questions correctly, you are the winner of Jacob Wants to Know.
Regulators.
Thank you for watching. Hope to see you soon at a hospital near you.
Take off the street. Gotta be handy with the steel if you know what I mean. Earn your keep. Regulators!